Right. Well, I'm here to talk to you about SNAP-Ed PSE work in Iowa, and throughout this presentation, I'll also talk about how we interweave direct education into all of our work, but really wanted to highlight all of the different PSE interventions that are going on across our implementing agencies. And so my name is Haley Huynh. I'm the SNAP-Ed coordinator here at the Iowa Department of Health and Human Services. So today I'll cover, just give you a little bit of a background of Iowa and kind of the realities of what we're working in. I'll talk about implementation of SNAP-Ed and our different implementing agencies, and then go into our PSE projects, talk a little bit about what's worked and what we've learned, cover some key takeaways from all of that, and then talk about what we're going to be doing next in regards to PSE in the future. So Iowa has 99 counties. We are your neighbors here in the Midwest, and about over 3/4 actually of our counties are rural. So it presents some unique that you'll hear about throughout today. We have been delivering SNAP-Ed here in Iowa for almost 25 years now, and we have 2 implementing agencies who deliver programming. And we've been doing PSE activities as a part of our interventions for about 7 years. So as I mentioned, I work for the Department of Health and Human Services here in Iowa. We are the state agency. Um, We're a bit unique here where I also wear a hat on the implementing agency team for Iowa Health and Human Services as well. So Iowa HHS serves as both a state agency and an implementing agency. On the state agency side, we have the Iowa Healthy Eating Active Living Partnership, or the HEAL Partnership, and that is equivalent to your SNAC here in Indiana. So that's Iowa SNAC Group. We've managed that for over 20 years now. Um, and then as an implementing agency at HHS, we also do Pick a Better SNAC, which is a direct education program for kindergarten through 3rd grade students. Fresh Conversations, which is a direct education program for older adults. And then we do 4 different PSE projects: Farm to School, Play Your Way, Physical Activity Access, and Community PSE. And we'll talk in depth about those later. And then Iowa State University Extension and Outreach, or ISU, is the other implementing agency here in Iowa. They do Buy, Eat, Live Healthy, which is a direct education program, as well as Plan, Shop, Save, and Cook. Both of those are targeted primarily towards adults, but have been used for older youth populations as well as older adults. And then they have 2 PSE projects, Growing Together Iowa and Healthy Food Access. So we'll start here with our school-based PSE. This is a project that HHS implements. It includes Farm to School and Play Your Way, and it is coupled with our Pick a Better SNAC program. So Farm to School and Play Your Way are both optional PSE activities that contractors who do Pick a Better SNAC in our we have 118 schools throughout the state where that program happens. They're able to pick up these PSE projects to amplify the message of direct education. And so you can see here we've got some great pictures of some kiddos in the garden. They help plant, they do activities. You can see there with the little boy with the magnifying glass, they do different games and activities to learn about where their plants and food are coming from. In the upper right hand, you can see a hydroponics garden that was started in a classroom, and that was allowed them to be able to do year-round farm to school. Similar to Indiana, we've got a lot of snow most of the year, so trying to find ways to do farm to school throughout the year, you have to get a little creative. And then Play Your Way is that bottom picture there, doing some physical activity in the classrooms. So some of the big successes, last year, these interventions reached about 9,000 students across 37 different school buildings in the state. Farm to School has helped lead to some changes on food menus in schools. One school district incorporated local apples into all of their work. Another school district introduced black beans onto their menu district-wide. So it's been really cool to see the big systemic changes that have come from this. There's also a lot of gardens with our farm to school work that do donations to either the families of the school or to local food pantries nearby, or a lot of schools have their own school food pantry that they put the produce in. And then Play Your Way has led to increased physical activity in the classroom, so lots of in-classroom physical activity breaks that they do, as well as more structured physical activity time and before and after school programs, and they've seen enrollment go up because of that. This is not to say that there hasn't been challenges and lessons learned along the way. So I would say most of our contractors have said that identifying a school champion can be very difficult. SNAP Ed educators come from outside of the building a lot of time in this model, and so trying to find someone in the building to help them maintain gardens, carry out the activities can be a challenge. Schools have lots of competing priorities and circumstances that are out of SNAP Ed programming's control. So that can also lead to some challenges because you're competing for time in the classroom, you're competing for permission to come in, several other things that a district goes through. And then sustainability is also quite challenging when you don't have those champions or help within the school. So if SNAP Ed educators or funding is to pull out, there's some challenges trying to keep things going. Another project is a physical activity-based PSE. This project's called the Physical Activity Access Project. It's geared mostly towards older adults, and so it's coupled with our Fresh Conversations program. You can see in the pictures here, these are some walk audits that they did, looking at different parameters that older adults and those with disabilities might face. So you can see there's kind of a big lip on the sidewalk, making it challenging for scooters and people to walk safely. There's no timed crosswalks in our bottom picture there, and then as you can see in that top picture, there's a nice covered bus stop, but there is no sidewalk or light or any safe way to really cross the road to get to that. So some of the successes this program has seen is changes to crosswalks, bike lanes, and bus systems. There has been development of transportation plans that incorporate physical activity and active transportation, whereas they may have focused primarily on car and public transit before. And then they're able to address those, as I was talking about, disabilities and inclusive practices, and really push that with cities and have planners put that into their designs and their work and make sure that's a consideration. Some lessons learned have been that it is difficult to make environmental changes when it comes to SNAP Ed funding. So a lot of these assessments that you do, it may come out that the sidewalk just needs totally repaired, and that's not what SNAP Ed funding is for. And so finding those additional funding streams to do the improvements that need to be done can be challenging for contractors. We found that prioritizing sustainability up front is also needed. It can be easy to say, we've got this great plan and we've mapped it out well, but let's just try it and see how it goes, instead of thinking about, if it does go really well, how are we going to make sure it keeps going? So kind of changing your frame of mind in the planning process. And then identifying eligible sites can also be kind of tricky, particularly in our rural communities. And I'll talk about that with some of ISU's work as well here in a bit. The next slide we have here is an ISU project that is garden-based. It's called Growing Together Iowa. Some of you that are part of the SNAC may be familiar, as it is a cooperative with our region, and Indiana does similar work. Some great successes that this program has seen is that last year it reached 33 counties, so about a third of our whole state, and that was with 115,000 pounds of produce being donated. That went out to 115 different food pantries that serve about 67,000 Iowans. So the reach and impact there was pretty great. It's also allowed ISU to provide culturally appropriate produce to pantries that's in season. And then the nutrition education materials that they couple with their work help shoppers make use of available items. Most of their work is targeted to an adult audience, but food pantries, as we know, serve families and a wide variety of audiences. And so um, some of the lessons they have learned is that implementation in PSE in rural areas is quite challenging. These areas don't have a lot of resources or assets. Oftentimes, even if there are resources and assets in these areas, they're spread out over large distances. So while we know there is a need there for helping low-income individuals, there's just not one great centralized location that meets SNAP-Ed eligibility oftentimes in these areas, making it just pretty difficult to try to reach the people most at need. And they've also found that layering PSE with direct education can be challenging. Sometimes you have capacity for one and maybe not the other. And so knowing that the intention of our PSE work and our direct ed work is to be coupled together, um, trying to actually turn that into reality can be pretty hard, just looking at capacity of staff and agencies and personalities of individual workers. And then our last project here is food pantry based. ISU does this in conjunction with Growing Together Iowa, and this is called their Healthy Food Access Program. They partner with food banks and food pantries across the state to do nutrition environmental food assessments. So we call that the NEFPAT. It's a tool that's used and it's in the SNAP-Ed toolkit. They perform these NEFPAT assessments at pantries and work with them to really brainstorm goals and objectives that work for them of the ways they want to make their pantry as healthy as possible and promote healthy items. So last year, they conducted that assessment at 48 different food pantries. On average, the food pantries made about 6 new improvements from pre to post. So over that year of working with them, they really chose and identified different ways that they were going to make their pantry improvements to be a little healthier. And most of them did at least 6. And then they also teach pantries how to increase their nutritious foods. So you can see in the pictures here, there's food bundles down in that bottom left photo. I believe that one was looking at making chili. On the other side, there's a recipe that they give. And so the ingredients are already there and they're able to make a whole meal out of bundling the foods together and they're healthy meals. You can see up in the right hand too, they do tastings of different healthy items. And those are all items that are then in the pantry that people can choose from so they can go make that recipe after trying it. And so they're really pushing towards having more nutritious options, more nutritious meals, and having it really be client focused. So there's a choice in what you're picking, and it's guided by knowing how to make those healthy choices. So some lessons they have learned is that food pantries are a good venue to meet our target audience. It's a place where they are already frequenting, and so you can capture an audience really great there. And it's especially in rural areas when you're trying to find that site, it's a good site that you know is an eligible location to be able to implement some of your activities. And they found that it's best to allow as much local decision making as possible. So I'm going to go to my next slide here that just kind of summarizes all of these lessons learned kind of into bigger key takeaway messages around doing PSE interventions. So as I talked about, identifying that champion or a group of partners really should be emphasized at the beginning. You want to plan for long-term maintenance and finding additional funding up front and having those things in your back pocket as you're working towards getting it implemented. because it's going to ensure that you're sharing roles and all of the weight isn't on one educator or one individual or only SNAP Ed funding. And so ultimately, the hope there is that you're increasing sustainability through that as well. You also want to develop a system to help communities identify eligibility of SNAP Ed sites. We talked a lot about how this can be challenging, especially in those areas with limited assets and resources like rural locations. So if you as agencies who deliver programming or give guidance or technical assistance, or it's really important to remember to help these local individuals be able to find where those places are and what qualifies and brainstorm the different ways to reach them. You also want to prioritize community needs by gathering data and feedback prior to implementation. So before you go into a community and say, we really want to do this intervention, make sure it's something that the community needs, that they've expressed it either in qualitative feedback you've gotten from them, or there's data that shows that, you know, there's just no parks around here and there's no way to be safe to be physically active. And so maybe it makes most sense to be doing something around physical activity versus just focusing on doing something in a garden. So making sure you're tailoring what you're doing to what the community is experiencing and wanting. And that goes into the next one of allowing as much local control as possible to these communities. One size often does not fit all. And so we found that the more you can be flexible, let them choose what's best for them. Communities often know their capacity. They know how people interact, where people go. So if you let them lead, you'll have a higher chance of being successful. And then lastly, working to identify sites where there is an agency and partner capacity. So this is really important when we talk about that direct ed and PSE. A lot of small areas may have an agency with only one person, and maybe that person isn't even full-time, or they only have a few hours to give to this. And so understanding that, trying to put that person to wear both hats and to have time to deliver direct education to individuals or groups and go network and implement PSE maybe just isn't realistic. So looking at where there's maybe areas to partner with multiple agencies or increase that capacity to reach these areas. So what is next in Iowa? The HHS team is launching what we call a Healthy Eating Active Living PSE RFP next year. This is going to incorporate both nutrition and physical activity. So as you had heard, we kind of have those offerings as separate as of now. And so we're really looking to combine them both because we know that both eating healthy and being active together is our highest chances of having healthy lifestyles. So and then we're also looking to incorporate breastfeeding where applicable. At HHS, SNAP Ed actually sits on the same team as WIC, so there's a lot of great partnership opportunities there. Communities will propose projects versus us telling them an intervention that they must implement. There'll be guides given and there'll be guidance on what projects could be, what's SNAP Ed eligible, types of projects others have done in our state and other states, but really letting them kind of pick from a menu of options. The intention here is to leverage work that's already being done, leverage other funding streams that agencies might have or that exist out there to apply for, and to promote interventions that prioritize that sustainability planning. And then we'll be working closely, as I mentioned, with WIC, the Iowa Department on Aging, and our local county public health departments to really help develop that and inform what is able to be done out on the local level and what are the needs there. ISU is also working hard to deepen their relationship with nutrition incentive programs and food pantries. They already work a lot with both of these programs, but they want to form a stronger relationship with GusNet Produce Prescription Program in Iowa. They provide a lot of nutrition education now to the Double Up Food Bucks program, but the produce prescription program recently got some additional funding and is expanding, and so they'll be looking to partner there as the next years go on. They're also expanding to a new food bank, which covers the largest region in our state with their healthy food access work. And as a part of that, they're adding an additional healthy food access specialist who will cover that area. And as I mentioned, it's our largest, most populous and urban area right in central Iowa. So that is all I have for you today. Happy to take any questions and feel free to email myself. My email's here on the screen. As I mentioned, I'm with our state agency, but also with our implementing agency here at Iowa HHS. And then Christine Raddick is our SNAP coordinator over at Iowa State Extension, who could answer a lot of questions about their Growing Together Iowa work and healthy food access work that they've been doing.
Thank you so much, Haley. That was so awesome. And I think a lot of our viewers are those who work for Purdue Extension and do this PSC type of work. So that'll be amazing for them. One question that I did have that came up was at the local level, like with, you mentioned champions and coalitions being so incredibly important. How have you seen at the state level local health coalitions coming together, local health departments to support this work that's being funded through SNAP-Ed?
Yeah, so the Iowa HHS team, we've actually are going through a pilot period right now. And so there is a program called the Iowa Healthiest State Initiative, who implements a program called 5210 Healthy Choices Count. It's a program that originally started in Maine, and so it's got a lot of traction in other states over the years. And then 5210 is focused at childhood obesity, and so it's really spreading that message of 5 fruits and vegetables a day, 2 hours or less of screen time, 1 hour of play, and 0 sugar sweetened beverages. And so the work that they do really pairs nicely with SNAP-Ed. And one of within Iowa HHS, there is SNAP-Ed, there is WIC, and there's 5210 on the same team. And so we've really tried to find ways of, if we're working to the same audience, how do we couple our funding? How do we leverage this further? And 5210 does a lot of community PSE work. Their funding is different than SNAP-Ed, so it doesn't have to be low income focused. And they can buy a lot of those things SNAP-Ed cannot. They can buy park equipment. They can help pay for parts of concrete or benches to make pathways better. And so we really looked at this model, and even though their funding restrictions are very different, they're finding great success, and it was through coalitions. A huge piece of what they have to do with 5210 funding is the first step is form a steering committee or a coalition that's going to guide the work. And so it's usually involves extension partners. There's a lot of transportation partners that are on there. So a lot of like metropolitan planning organizations, local county public health, schools, WIC clinics. And so we really push them to encompass a wide array of people, so they're getting all aspects of their community. And so that program has been going for nearly 10 years now, and we thought, how can we replicate this model? And so in the pilot we're doing, we have 4 different counties we're working with, where we gave them parameters of SNAP-Ed to work in low-income areas. But we tried a model of form this steering committee and go through a lengthy process of planning and needs assessment. I think often we know coalitions work, and then they get together and it's like, well, what do we do now? Like, what are we meeting about? And if you're not making that a purposeful group, people have a lot of other things to do. And so that kind of falls off calendars and off radars, and you lose engagement from members. So we had them form a steering committee. We gave them suggestions of people who might be working with low income populations to make sure they're incorporating them. Then we had them do a community asset map. So we gave them a training about how you look at the different assets. That can be from physical assets to staff capacity to the different programs in your community. And we kind of left it wide open of that looks how it's going to look for you. You gather people how you gather them. You form that meeting. Some people just had discussions and took notes. Others did jam boards online. Others did put big sticky notes on the wall. So you can really talk through like, what are the things we have going in our community already? After they did this, they were able to then submit those findings to us, and we proposed different needs assessment tools that matched what we were seeing in their assets. So if there were a lot of assets around like youth programs, and maybe SNAP Ed was there already, and there's rec leagues, we gave them tools that were based around either schools or youth to go through and see what's an actual intervention we could do together. And so they convene their group back again. They'll go through that needs assessment and they'll give us their results and propose a project based on this process. So it was about a 6-month process, but it really gave purpose to this coalition. If their project is SNAP Ed eligible and fits within 5210 funding as well, they'll get funding for the next 3 years to be a 5210 community. SNAP Ed will still be involved in helping support some of that, but it'll really keep the momentum going for this group. So it feels like they're a little more action-based versus just coming to share things out.
Yeah,